guys, my name is Amber Swords. I'm a physical therapist and co-owner at Be Strong Therapy Services. Today we're going to be discussing a little bit about neuropathy, specifically chemotherapy-induced peripheral neuropathy. So this is something that you'll see when you're undergoing chemotherapy treatment, and it'll affect the peripheral nerves, which just means that these will affect nerves that are going away from the body. So we'll typically see this in your hands and your feet, and you can have sensory involvement and you can have motor involvement. So with sensory involvement, we'll see a lot of numbness, tingling, sometimes hypersensitivity, so patients can't tolerate touch, or having just some socks on their feet can be painful. This can also affect your balance too. So anytime you're starting a new exercise program, you want to make sure that safety is your number one priority. So those sensory issues that you may be experiencing can affect your exercise program. Another thing that we'll see is motor involvement, typically causing weakness in the muscles that help you to stay upright and to control your balance. So those are some things that we want to be aware of. The chemotherapy drugs that you may be on may be what's called neurotoxic or toxic to the peripheral nerves. There are some things that you can do about your peripheral neuropathy. We can't ever really heal the neuropathy, but we can help to bring oxygen to that area and blood to that area, which can help you to decrease some of that pain and or motor weakness that you're having. So exercise has been shown to help. If you think about it, if you do like an ankle pump, you're bringing nourishment and you're bringing blood to that area. So the research says that increased blood and increased oxygenation can actually help to give the nerves what they need to function properly. Increasing strength can also help because you're increasing the strength in those muscles that help you to stay upright and help you to keep your balance. Exercise also can provide good oxygen delivery to that area, and increase the glucose delivery to that area, which can also help with nerve health. Some things to consider when you're starting a new exercise program include safety. Safety is always the number one thing we want to think about. In the clinic, I'll typically have people either hold on to a chair or put their back in a corner and a chair in front of them for safety. So when you're going through these exercises, you can find what works for you. So safety is number one. You don't want to put yourself at risk for falling when you're doing these exercises. You can always modify exercises, so there's always ways to do these exercises. If you need to modify down, that is perfectly fine. It's better for you to modify down than to not do the exercise at all. There are some things you can do to desensitize that area, so if you end up having sensory involvement from your CIPN, I would suggest meeting with a physical therapist or occupational therapist to go through a specific program to help you desensitize that area. Those programs can include a thorough evaluation by the therapist, and they will establish a program that will work for you. Typically that will involve starting with something like a cotton ball and rubbing that area, or just rubbing lotion on that area. Some people can't even tolerate that little of touch. And you would typically progress from like a cotton ball to sandpaper or something that's like a little bit more, irritating to that area. If you start these exercises in the demo videos and you have trouble keeping your balance, I would definitely suggest meeting with a physical therapist to address those balance issues. And what they'll do is they'll give you specific balance exercises for the areas you're deficient in.
Hi, today we're going to show you how to do Kinesio Tape or any other therapeutic tape for peripheral neuropathy. This does two things. One is one of these tapings will help with pain that you may be experiencing from peripheral neuropathy in your feet. The other taping will help with balance due to peripheral neuropathy. You want to make sure that you don't have any skin integrity issues. If you have peeling skin, if you have skin breakdown, if you react when a Band-Aid is placed on your skin and you break out in a rash, this may not be the taping for you. There are some medications and some chemotherapies that you don't want to use Kinesio taping or any other type of taping on your skin. So always check with your physician before you attempt to do this. So first I'm going to show you how to cut the Kinesio tape. We like to use a roll. The roll works better for us so that we can adjust the size of it. You can buy this Kinesio tape on the internet. You can sometimes find it at your local pharmacy. So for the first one that we're going to do, which is what's called an eye strip, we're going to put that just behind this ankle bone or the lateral malleoli We're going to put that just behind it, so closer to the heel. We're going to cut that to about 15 centimeters long. You want to kind of measure, gauge, and then cut that strip. You always want to round the ends. That just helps the tape stay better. We're also going to cut this fan pattern. So you can see there are individual strips. I'll show you that a little bit better here. And then the top of it is one solid piece. That's going to be your anchor. So you'll cut the Kinesio tape round the end, and then you're going to look at the bottom of the foot for this one, measure from the heel up to the toes, and then cut the end of that tape. And almost all of the tapes have these guides on the back, so you can kind of cut on those lines. For the purposes of this video, we are going to use pre-cut tape. You always want to do some skin prep. If you don't, in the clinic we use alcohol swabs to clean the skin, just to get the residue from soaps and lotions off. At home you can use soap and water and just make sure that your skin is very, very dry. So here we're gonna, Kaylee's been gracious enough to let us do this on her. Just gonna kind of clean off the base of her foot and let that dry. And then here, just behind, again, that ankle bone or the lateral malleoli. We'll let that dry for a second. The first one we're gonna do, here you do want the skin to be on stretch. So I'm gonna stretch her foot out in just a second. The tape, you do not want to touch the adhesive part of the tape, so we're gonna tear the bottom, maybe 1.5 inches up, 2 inches up. Pull that paper back and hold on to the paper. That becomes sort of your anchor. Okay, I'm going to have you do your foot this way and then toes up. You can employ the help of a friend if you need to. This anchor goes on with no stretch. In the research study that showed that this helps improve balance, they put about 50% stretch on that tape. And I'm just rubbing to help it adhere, and then no stretch on the end or the anchor. What this does is stretches the skin around the ankle and gives the person input, so that when you're standing and you're swaying, it actually gives feedback to your brain that your balance is sort of off. The second taping, the fan taping that goes on the bottom of the foot, is for the actual pain from peripheral neuropathy. Again, it gives input or sensation to the person where they're missing some sensation to help with pain. These don't work for every single person that we've ever used them on, but for a good percentage of the population, they recognize the benefit of this. So again, I just sort of tore that paper. I'm pulling back on the anchor so that I can apply it to the heel of her foot. You can see how this would be better with a friend to help you out. I pull the paper back on one of those strips, lay it down, and bring it all the way down to the toes. And it ends right below the base of her toenail. You don't want to necessarily wrap it around the toenail, just because it'll pull back on that toenail. Tape, therapeutic tape, whether it's Kinesio Tape, Rock Tape, or any other brand of therapeutic tape, should not be on your skin for more than about 3 days. In order to get it off, you want to apply a lotion, milk of magnesia, or some type of oil. Soak it, and or after you've taken a shower or a bath and you've soaked in some water. If you start to have some kind of skin reaction, go ahead and remove that tape sooner than later. You do not want to use a hairdryer or any other heat source to dry it. You can wear it through a shower for those first 3 days. Just let it air dry. The adhesive is heat activated. So once I have that fan on there, I rub again with the heat activation, activate that tape, and then here also. You want to apply an eye strip both to the left lateral malleoli, sort of just behind that, closer to your ankle and up. And then on the right, you'll do the same. And then the fan tape on the right as well. If you have any questions or concerns, you want to talk to your physical therapist who can do this, or you want to check with your doctor before you start taping. Especially if you're in treatment for chemotherapy, there are a few chemotherapy drugs that you're not allowed to do this to your skin because your skin is not healthy enough to be able to do this while you're in chemotherapy. Thank you.